Topic of today's practical is bleeding time. What is bleeding time? That is the time from the onset of bleeding from the cut surface till the bleeding stops. So what is the normal value? That is 1 to 5 minutes. Well, bleeding time, it depends upon two factors. One is vasoconstriction and the second one is platelet plug formation. And these both are components of hemostasis. What is hemostasis? That is basically arrest or stoppage of bleeding. It has three stages. First one, vasoconstriction. Second one, platelet plug formation. And the third one is the coagulation of blood. Coming to the vasoconstriction, what will happen whenever there will be injury to the blood vessel or damage to the endothelium will happen? It causes the exposure of collagen. This exposure of collagen will cause the adherence of platelet to the collagen, which will be enhanced by von Willebrand factor. Now, after the adherence of platelet has occurred to the collagen, which will result into the activation of platelet. This platelet activation will cause the secretion of serotonin or the other factors which causes the vasoconstriction. So basically, that is vascular spasm. So vascular spasm will happen and it will prevent the further loss of blood. Second step is platelet plug formation. So what will happen in the platelet plug formation? There would be primary hemostasis. In the primary hemostasis, that is the first step basically in this. So first, endothelial injury, exposure, adhesion, activation and the aggregation will happen. Basically the same 5 steps will happen here. So injury to the blood vessel and the damage of endothelium occurred, exposure of collagen, adherence of platelet to the collagen by the von Willebrand factor enhancement, activation of platelet, and this activation of platelet will result into the secretion of ADP and thromboxane A2, which will cause the aggregation of the platelet and enhanced by the platelet aggregating factor, and this will result into the platelet plug formation. This platelet plug formation is loose. It is just a loose platelet plug formation which will prevent the further blood bleeding. Now, after the activation of platelet till here, there will also be formation of prothrombin activator which will cause the blood clotting. So basically secondary hemostasis. Stoppage of bleeding by fibrin clot here. So this is the second step will happen. So after that, if we see this diagram, vessel injury happen, vascular spasm, third formation of platelet plug, and then the coagulation would happen. The factors which prolong the bleeding time, these are first thrombocytopenia, in which the platelet count will be get decreased. Second, defective platelet function, it can be congenital and acquired. The congenital thrombocythemia, and in acquired it can be drug induced due to aspirin drug, uremia or hyperglobinemia associated with the multiple myeloma. Third, von Willebrand disease, if it is reduced, it will increase the bleeding time. And the fourth one is disseminated intravascular coagulation.
Practical of today is to determine the bleeding time. The learning objects would be determine the bleeding time by Duke's method, know the normal range of bleeding time, the steps of platelet plug formation, and also understand the condition in which bleeding time is prolonged. So what is bleeding time? It is a time from the onset of bleeding from a cut surface till the bleeding stops, and it depends upon two factors. One is vasoconstriction and the other one is platelet plug formation. Coming to the principle, what is the principle of bleeding time? It is a standard skin puncture is made and the length of the time required to stop bleeding is recorded. Well, it determines what? The function of platelet and the integrity of capillaries. How are we gonna perform it? What is the protocol? Well, the protocol is introduce yourself first, then take consent and explain the procedure to the patient or the subject. While apparatus will be shown in a while, the method, there are 4 methods by which this can be performed: Duke's method, IV method, saline beaker method, and template method. For this experiment, we are gonna go for Duke's method. and it will be shown in a while. Precautionary measures you have to take, read it from here. And the clinical significance that the bleeding time is prolonged in the following conditions. Thrombocytopenia, that is basically decrease in the platelet count. Defective platelet function, it can be congenital or acquired. Von Willebrand disease and disseminated intravascular coagulation. And the questions you guys should know is define bleeding time, list the causes of prolonged bleeding time, and what are the functions of platelet. There are the functions of platelets can be initiation of blood coagulation, repair of capillary endothelium, clot retraction, and also when platelet disintegrate, they release the serotonin and histamine. The serotonin is a vasoconstrictor and helps in hemostatic function, which is the prevention of blood loss. And also the platelet also contains blood group antigens. There is a scenario given. This is of the idiopathic thrombocytopenic purpura. That's it.
Now we are going to start the practical. The apparatus that is required to start the practical is stopwatch, alcohol pad, lancet, and the filter paper. To perform this practical, we are going to use the Duke's method, and the sides that can be used for it are two sides, ear lobule and the fingertip. To perform with the fingertip, we are going to first use the alcohol pad and we are going to clean our fingertip. So any germs that is present on them, they can be disinfected. Now after cleaning it, we have to let it dry. And now we are gonna prick. First we are gonna apply at the 0 second and we're gonna start the timer right away. After 15 seconds, we are gonna again do the spot. Now at 30 seconds. At 45 seconds. At 60 seconds. At 1 minute and 15 seconds. So there is no blood at 1 minute and 15 seconds. So we are gonna stop the stopwatch. Now we can have to calculate how much bleeding time has occurred. We are gonna count these numbers, the spots basically, 1, 2, 3, 4, 5. So 5 multiplied by 15. That will give us the bleeding time. Now we will start labeling at 0 second, 15 seconds, 30 seconds, 45, and the last point where no blood was present, that would be 1 minute and 15 seconds. Now what are we gonna do? We have to count 1, 2, 3, 4, 5. So these are the 5 multiplied by, so 5 multiplied by 15 seconds, that would be 75 seconds. That will give us 1 minute and 15 seconds. So bleeding time would be 1 minute 15 seconds.